Professor, thank you very much for your valuable presentation. It was very detailed. Thank you again. We can continue directly with the second presentation, which is going to be held by Hassan Avel. He is going to speak about just a second. He's going to speak about horse hoof anatomy. Okay, it is done. You can start with your presentation. Thank you very much.
Okay, thank you, Mr. Chairman. First of all, let me introduce myself. My name is Hassan Awal. I'm Ethiopian. I'm a student at Ankara University Department of Anatomy. I would like to thank the organizing committee of this conference, and I'm very happy to being part of this conference. Having said this, let me proceed to my presentation. The title of my presentation is Anatomy of the Horse Hoof. Let's start with the term hoof. The hoof is explained as the horny structure or horny enclosure that surrounds around the distal phalanx, and some scholars defined it as not only the horny structure, but also it contains the soft tissues that found in the inner surface and the skeletons, just like the distal phalanx, the cartilage, the ligaments, the blood vessel and nerve system. Mainly, the hoof is composed of the hoof wall, sole, and frog. Let me try to explain each of them separately. The hoof wall, it is part that visible from the external surface in the front and inside of the hoof, and it is very hard and hard structure. It protects the delicate structures that found in the inner surface, and also it absorbs the shock as the horse move. This hoof wall it has no blood vessel and nerve, and it continually grow in the keratinous material that needs to be trimmed or naturally it worn off. The hoof wall is separated, or the demarcation found between the skin and the hoof wall is called coronary bands. And below the coronary bands, we found the preople, and it is soft. It is just soft, just below the coronary band. It helps to protect the hoof wall. And this preople is widened on the palmar surface and the plantar surface to join the frog and bulb of the segment. The hoof wall, it has external and internal surface. When we see the internal surface, it has a line which is lined with the laminar layer, and on top of the laminar layer, there is a coronary groove, and between the laminar layer that found in the inner surface and the outer surface, there is a white line. These are derived from the epidermis, but there's other structures that surround us on the distal surfaces, which derived from dermis, and it's called corium. The corium part, when you see it from the dorsal part, this line is called corium limitans, and this swelling or the bulged area is called corium coronarium, and the surface is called the corium paris. The corium paris also lined by a laminar layer, which is derived from the dermis. The parts that are derived from the dermis it is sensitive, and the parts that derived from epidermis is non-sensitive. And this corium is just bind with the hoof wall with the internal part of the hoof wall. As far as the sole is concerned, the sole is the parts that found between the frog and the hoof wall, and most of it does not have a contact with the ground because it is a bit concave. The structure of the sole is similar to that of the hoof wall. However, the keratin found in the sole is more easily rubbed forward down than the hoof found in the whole wall. The sole also helps to protect the inner working of the hoof, and it is designed to bear internal weight transferred through the border. The hoof and the sole is demarcated by the white line or zona alba, or it's also called linea alba. It is used to attach the sole with that of the hoof wall. The sole has a body parts, and in the side of the body parts it has a cruce solia, and this anatomical structure found on the dermal part also, on the epidermal part also found in the dermal part. The third part is frog. It's also called Pulphinus ungulae. When we pick up the hoof, it is visible as a V-shaped, and some outer side is visible as a W-shaped. It protects the digital cushion beneath it, and it tracks traction and circulation in the hoof, partly acts as a shock absorber when the horse moves. It has also the epidermal parts, the strong part, the outer part, and the one which is covers the distal phalanx is called, it is derived from the dermis parts, and it is the dermis part is densely covered with plumpy papillae, which are shorter than those of the sole dermis and are spiral in orientation. When we see the anatomical structure of the frog, if you see here, there is a groove which demarcates between the cruce of the sole and the frog. This groove is called Paraconial groove. It's Paraconial groove or Sulcus Paraconialis. It is found in the both side, Sulcus Paraconialis, lateralis, and medialis. And in the center, there is also a groove, and it's called central groove. Also, it is called Sulcus conialis centralis. It has an apex and a base. Between the central groove and the paraconial groove, there's a bulged area, and it is called crusconi lateralis, and medialis. Just to give highlight on the inner framework of the hoof, there is a bone called coffin bone or distal phalanx. The distal phalanx.
Dear Hasan Avel, sorry for interrupting you. We can't see your presentation. You didn't share it.
Sorry, let me share it.
Thank you.
What about now?
It's okay now.
I've discussed all of these parts, and let me proceed from here. Here, the inner framework of the hoof wall. The first part is the distal phalanx. Actually, the hoof wall covers all parts of the distal phalanx and some part of the middle phalanx. The distal phalanx is the largest bone in the hoof, and it helps to shape the hoof wall, and it is surrounded by special tissues that help make up the lamina of the hoof as well as the tissue of the sole. And also there is a navicular bone. It is just a small bone that is tucked behind the coffin bone and the short pastern bone. Let me see the distal phalanx. The distal phalanx has three faces. The first face is the parietal face that's found on the front side and in the both in the front and both sides. And the other face is the faces articularis, and the other face is the faces solaris. The faces parietalis demarcated from the faces articularis by process extensoris, which is used for attachment of the extensor tendon. And the Fascious patellaris on each side, it has a process palmaris. Sometimes there is a sulcus palmaris. This sulcus palmaris can be visible as a hole, and when it is visible as a hole, we call it foramen palmaris. When we see the underside, it is fascius solaris. The fascius solaris is divided into two by linea seminularis, the cutaneous part, and the area extensor, area flexor. The area flexor is used for attachment of the flexor tendon. On the either side of area flexor, there is a foramen solaris. On either side of the foramen solaris, we found the sulcus solaris. The other inner framework is the tendon. Actually, there is two most important tendons. The extensor tendon, which attaches to the process extensoris, and the other is the deep digital flexor, which attaches to area flexoria of the distal phalanx. Also, we found the cartridge, angular cartridge. It is found on the top of either side of the distal phalanx, and it was also part of, it is